okay for you? Can I have your wristband, please? All right, with the right patient, we'll make sure to have the patient privacy, and we'll make sure if my patient is on the comfort position. Do you have any question before we start? Do you want to use the washroom? All right. So we'll start with the general survey of my patient. Before we start that, we make sure to have the hand hygiene. Put on clean gloves. And I've cleaned my stethoscope as well. All right, we'll check with the level of consciousness with my patient. She's older than oriented times 3. Do you know where we are right now?
Yeah, in the lab.
All right. So, do you know what time is it?
Yeah, it's 1.
She's oriented time 3, and the level of consciousness is fine. She's well hygiened, and she's raising up properly according to the waiter. The skin is intact, and to the genetic background, she's smiling in a good mood and speaking clearly. She's sitting right up, and I don't see any physical deformities on my patient, and she can respond to everything, and she's following my comments. We'll start with the facial assessment. We'll see for any side of drooping on the face, any masses, any lesion, redness, any bruises on the face, which I don't see, and it's all normal. We'll ask the patient with checking the cranial nerve 3, which is the cranial nerve 7, which is the ocular, which is the facial nerve. We'll ask the patient to smile from his eyebrows. All right, cranial nerve 7, which is the facial nerve, is intact. Now we'll move forward to the eyes, which is we'll ask the patient to close the eyes. All right, so the lids are intact, colors intact with the genetic background. I don't see any lesion, any redness, or any bruises. The hair distribution is same on the eyebrows, and they're symmetrical and aligned. And the lashes are like the same, clean, no infection. We'll ask the patient to look up. Sclera is white and the conjunctiva is pinkish. You can see the blood vessels, no sign of infection or any moisture, like extra moisture on the eyes. We'll check the cranial nerve 3, which is the oculomotor, for the light reflection. All right, and now we'll do the accommodation test. Can you follow the tip of my finger? All right, so the pupil size is 3, and the eyes are inverting inside, and the pupil are reactive to the light, which means the cranial nerve 3 oculomotor is intact. We'll move forward to the ears. We'll check the ear for the external structure of the ear. If the ears are like aligned, the size is same, no deformities, no discharge, and we'll move forward to the nose. We'll ask the patient to pull out one side, other side. Take a deep breath. She's not using any excessive muscle for breathing, and the nose is aligned on the midline. And we'll move forward to the mouth. We're checking for any side of cyanosis, dryness, dehydration in the lips, and we'll ask the patient to open up the mouth to check the cranial nerve 9 and 10, which is the glossopharyngeal and the vagus. Can you open up your mouth? All right. I say All right, so the soft palate raising up while the patient is saying and she's swallowing her saliva. So the trachea is like midline, which means that both cranial nerves are intact. And now we're moving to cranial nerve 12, which is the hypoglossal. The hypoglossal will ask the patient to stick out the tongue up and down. All right, side to side. So the cranial nerve 12, the hypoglossal is intact as well. Now we'll move forward to the shoulder with the neck. We'll ask the Here we'll do the inspection. We see any side of bruises, swelling, or any masses on the neck. We'll basically we have to check from the back for the palpation to see any enlargement on the thyroid. But for the purpose of the test, I'm just doing this to save the time. Turquoise midline, and there's no enlargement of the thyroid gland. Now we'll check the cranial nerve 11, which is the spinal accessory. We'll ask the patient to shoulder, rotate to right and left. All right, against the resistance, up and right. Okay, up and right. All right.
Up and down.
Up and down. Cranial nerve 11 is intact. We'll now move forward to the thorax, or the posterior. We'll inspect first. We'll see for the posture, which is upright, and the spinal is like in the midline. No deformities, physical deformities. It's aligned, and I don't see any lesion, any bruises, any masses. We'll ask the patient to take a deep breath. All right, it's aligned and symmetrical while she's taking deep breath, and now we'll move on to the auscultation. We'll make sure it's on the mid of the cervical.
So we know that our patient is underorientated, hamstring. Looking at the patient, they look their stated age, as well as their skin is appropriate for the ethnic background. And looking at the body structure, is symmetrical on both sides, from muscles and masses. They are nutritional health, they're not overweight or underweight, they're normal. Their overall body stature and height is good, as well as
so I can hear like the T1 and T2 on the bronchiovesicular, and the T3 to T12 on the vesicular area, which is normal, no crackle sounds. And now we'll move forward to landmarking of the apical pulse, which is in the mid-clavicular on the left side, which is in the left on the fifth intercostal space close to the mitral. We'll check for we'll do the auscultation.
Okay, I'm going to ask the patient now to, can you smile for me? Continue frowning for me. Can you close your eyes?
So it's 75 beats per minute, which is normal and the rhythmic regular. Now we'll check for any murmur sounds with the both side of the my stethoscope.
Next, we're going to go to the eyes. I'm going to look at the eyes. Looking at
I can see the T3 and T4 and no murmur sounds, which is really normal for my findings. And now we'll move forward to the abdominal assessment. Can you lay down, please? All right, you gotta remove your shoes. Fast.
It's okay, just put your feet up if you need to. Because I have a foot muscle spasm on my back. Yeah.
Sorry. I know my patient is like in a good position. We'll do the patient privacy and we'll make sure patient is in a comfort position. Are you okay? All right. So we'll first we do the inspection. We see the umbilicus in midline, no deformities, no like the abdomen is like round, which is normal. I don't see any discharge, any swelling or any edema, any bruises on the abdomen. Now we'll start with the auscultation.
So they both equally constrict and dilate and constrict.
We'll start from the right lower quadrant.
Next, we're going to do for accommodation. Again,
Go to right upper quadrant, clockwise and circular clockwise, to the left right quadrant, and the left lower quadrant. I've heard like it's 9 beats per minute, which is normal, and I heard like the high pitch and gurgling sound. Now we're moving forward with the palpation. We'll start from the same the right lower quadrant. We're doing with this clockwise and circular motion. We're checking for any tenderness. Let me know if you feel pain, tenderness.
Next, I'm going to my mouth. The mouth, the lips are equally symmetrical, red, and
Alright. So with my findings, I don't see any facial expression, no tenderness, no pain, and I don't see my patient to go the abdomen, and she's not feeling any kind of like discomfort on the abdominal, which is all like within my normal findings, and I'm done with it. Thank you.
Okay, all right, you guys are done.